In this Instagram friendly world, our self-esteem is often linked to the way we look. And then my patients who visit me often ask me, Doctor, will this treatment be permanent? And here's the reason that for most of the skin and hair related procedures, you require maintenance sessions. The most superficial layer of the skin, which is the epidermis, tends to replete itself every 28 to 56 days, such that the skin that you're seeing right now will not be there almost 2 months later. That is why any changes that we have done on this skin, be it the hydration status giving you that glow, be it the improvement in tanning, tends to persist for a short duration of time. But for the deeper layer of the skin, which is the dermis and which has collagen, the results last longer. So anything that builds collagen, be it anti-aging procedures that builds collagen like thermal therapy, microfocus ultrasound, or it could be scar remodeling procedures like fractional laser, microneedling, dermapen, dermafusion, tends to last long because they work at the deeper layer of the skin. Same goes for our hair as well. Hair is a dynamic organ, just like our nails that tend to grow, then they break off and then they regrow. Similarly, our hair grows in a cyclical fashion. It will grow, it will reach a plateau and then it will shed off. And therefore, whatever procedures have been done on the scalp tends to remain for that duration of time. Exception to this is any skin infection. If proper antibiotic, antiviral or antifungal treatment has been given for adequate duration of time, the treatment of infection is permanent. So next time you visit me and ask me that whether the treatment is permanent or not, keep this thing in mind.